So I haven't done this before. Come on down. And what you're going to do is, as I pull stuff out of this commercial first aid kit, I just picked one that we sell that seems to have a lot of stuff. You're going to cross it off the list here. Okay? Yes, you'll need your glasses. Okay. And look, one of the things that I have on my list for a first aid kit, now that I'm of a certain age, is reading glasses. Because I couldn't read my thermometer. I couldn't read the bottles anymore. It's about dewormer season. I couldn't read the weight and the dosing, so reading glasses is on the list. Okay, so this is your piece of paper, and this is your pen, and you give it back to me at the end. And then I'm just going to pull stuff out, and then what these people are going to do, everyone has a job. What you guys are going to do is tell me what it's for. Okay? And if you have one, so let's start out with who has a first aid kit? About, I would say, slightly more than half. So good for you, bad for the other people, boo. Where did you get it? Where did you get yours? Or did you make it yourself?
I'm a medic and I made it myself.
Okay. Who else? Made it yourself? Okay. The nice thing, I'm not trying to sell you this, but the nice thing about this is it has a lot of pockets. And so even if you don't like the stuff that I pull out of it, it's a way to keep it organized. You know, and you need to go through it and learn what's in there and use it. And you may decide that I want all of my bandaging stuff here, and I want all of my little tools here, like hoof picks and flashlights and thermometers and stethoscopes. That's all what you'll do. So, but you need to figure it out. So that's what we're going to do today. You ready?
I'm ready.
Okay. I better start at the front and work back. All right. This is a fake pocket. It's you can put tall things in because there's sewed here, and so there's these pockets here. So this would be good for pens, markers, hemostats. What are some tall things? Hoof picks would fit here. Things that would stick out that you could grab. Okay, so now we're on the middle pocket. We'll do this one right here. So I reach in here. Oh, when you're putting together a first aid kit for horses, don't forget that many times when the horse is injured, the human is injured. This clearly is not a horse bandage. We all agree? Okay. This is a human Band-Aid. So this kit has a lot of human stuff, and this whole middle pocket here is full of Band-Aids. This looks like, I don't have my glasses on, it's a soothing menthol gel. Okay.
Biofreeze.
Okay, so I'm in another pocket. What are these?
Scissors.
What kind? Bandage scissors. Why are they bandage scissors? Because they're not sharp at the ends. They have this flat surface where you can reach up under bandages and cut. These need to be in everybody's kit. I'm going to lay stuff out here and then, yeah? Okay, so here's some thin tape. I like to have about 3, 4, 5 different kinds of tapes. I learned from the video person at SmartPak, there is something called gaffer's tape.
Gaffer?
Gaffer.
Yeah.
Gaffer with F.
Gaffer.
Correct. You win the spelling bee. And it's a kind of a duct tape, but it's cloth, and it tears perfectly, and so I'm going to add that to my first aid kit.
And it's really sticky. I think
Is it
some
really
that I
sticky?
never use.
Okay. So tweezers. I actually don't know what that is. Oh, it's got here. Yeah. It's got a sharp thing, so it's a cutter. This is actually a good thing to have. There's a couple of them. Let's see what else is in here. This is really fun, you guys. Oh, safety pins. I maybe wouldn't have thought of that for a first aid kit, but that's
What would you use them for?
maybe putting a bandage together. If you had, if you were using a pillow wraps and a standing bandage, that sort of thing, yeah. Okay, let's see what's in this one. More human, there's aspirin and ibuprofen and those kind of things. All right, so let's go into the horse part. This looks like surgical sponges. This is multi-trauma dressing. So one note that I have on my list of things not to forget to say is only have in your first aid kit what you know how to use. If you don't know how to use it or what it's for, then don't have it in there. So a lot of people, one of the first questions I get asked about building a first aid kit is, all great, but what drugs should I have in there? And I always say, well, what drugs do you know how to use? If you've not given an IV shot, if you don't know how to give intravenous medication, then you have no business having it in here. So if that's not a comfort zone for you, then I recommend your first aid kit have pastes of Banamine and Bute and whatever prescription medications your veterinarian has talked to you through and has told you how to use. Do you have a question?
Yeah. In my first aid kit, I have everything to administer the medicine, but I do not have the medicine itself. I keep the medicine itself separately to control temperatures. I don't know what your thoughts are on that.
Of course I have thoughts. I have opinions on everything. Did you guys hear what she said? She said she has in her first aid kit, she keeps the syringes and needles to be able to administer the medication, but the medication itself is stored somewhere else to control the temperature. I will say, if you're going to have medication, read the label for what temperature it needs stored at. You will be surprised. Hardly any of them say store in the fridge, which is what everyone does. But I don't know any of them that really say that. Maybe if you mix up a antibiotic and for a few days it needs in the fridge, but most of them don't. They just need room temperature, controlled, not variance of heat and cold. So make sure you're storing it in the right place.
In a cooler. I keep all my medicine.
Yeah, a cooler.
In a permanent
Yep,
cooler.
a cooler is a great idea. Okay, this looks like, it looks like sterile prep, I'm not sure what you mean by that, but like what you would lay out before you would do a surgery or something. It's just to keep the area clean. Yeah. This is a 4x4 cotton gauze pads. These are great for cleaning with solution. These are great for padding if there's bleeding. So I like those.
Those are not necessarily sterile.
Correct. Oh, so my horse just had a wound recently, and I asked my barn owner, who is a nurse anesthetist, if you have an option of having a barn owner as a nurse anesthetist, I highly recommend it. She has access to a lot of stuff, and she knows a lot of stuff. I'm gonna rip this a little bit because I want to show you this. And I asked her, do you have brown roll cotton gauze? What? Brown roll cotton gauze. And that's what she said. What? Because that's not something that I guess they use in human medicine. But I can't live without this for horses. This stuff is amazing. What I'm doing right now is I'm using a nonstick. No, it holds. So he's got this injury in the front of his fetlock, and I've got a nonstick Telfa pad, and then I wrap in a figure 8 around the fetlock, and then I put my bandage on. But it just holds the dressing to the wound. I don't know how you live without this stuff. This stuff's amazing. Oh, these are gloves to keep you clean. Sorry?
You tape it to hold it?
After this, we'll see if it's in here. I have a little bit of Elastikon on it, and then some Vetrap, and then I put a polo. My bandage has changed as it's been healing. It was a big standing bandage at first, and now it's more of an exercise wrap. And then I'm going to move Saturday, tomorrow when I go home, I'm going to take it down the next step. So you'll remember where all of these things go, right?
Absolutely.
Okay.
All of this is trauma related, so it would be in the trauma pouch.
Excellent. All right. This has tongue depressors, long Q-tips. Oh, an iodine. Oops. Whoops. You didn't see that. This is I'm not going to open it, but it's an iodine swab stick. So it's a Q-tip like this, voila, with iodine already on it. These are super handy. What I'm hoping is in here is a little brush with iodine scrub in it, because when it comes time to clean a wound, you don't want to have to fuss and fool with getting saline or water or whatever and getting a sponge and getting the iodine. If you can just rip open the bag and there it is, that's sweet. Oh, and I bet these are the nonstick, yeah, the nonstick. The nonstick Telfa apparently is a brand. These are non-adherent pads. I'm not supposed to use brand names apparently. Okay, all right. So, oh, I don't even know where that came from. Another cutter. Oh, this is getting exciting. What is this? A sharps container. The rules for what to do with sharps. What is a sharp, by the way? A needle, a scalpel blade, something, I don't know, sharp. So the rules for how to dispose of these will vary not only from state to state, but county to county and probably municipality to municipality. So find those out, ask your veterinarian. They might do you a favor and take yours and dispose of it. It's very small like this. And also each jurisdiction will tell you what, if you don't have one of these, what you can use to, because you can't use, this is a really thick plastic, and when you close it for good, it's closed for good. Like you can't open it unless you break it. And so some things, they're not thick enough plastic, needles can go through them, and also you can't close them, so they're a little picky. All right, so this is roll cotton. Roll cotton has a number of uses. What are some? Well, I tear it and use it for sheath cleaning. It's not really a first aid thing, but I keep it in my kit. It's good to wrap around a leg for padding. So there's tons more uses. Oh, and there's two, yeah, so that's cool. This is like the middle high kit. So there's some kits that are very, very small. They just have the basics. And then I think there's a bigger one than this even, which I couldn't carry that one. So that's why you got this one. But the other kits probably wouldn't have two sizes. They would just have the one size. That's the difference. Oh, this is heavy. This must be Epsom salt. Okay, so this we use to soak things. And I had a container like this in my first aid kit, and I never used it. So I took it home and I put it in my own bath because it felt, I did one of these things and I just got really muscle sore, so I thought, I'll use it. Okay. This is blood stop powder. That's a lot of it. My goodness. So what I would do is I would use it by taking one of the Q-tips and using it that way. If you need more, I guess you use more, but that's a lot.
That's safe on any wound?
This is something I would probably talk to my vet before using. What would be fun is to get one of these kits, or even the one you made yourself, and then have your vet out and say, can we go through this and make sure I know how to use all these things? Do you want me to have this in my kit even? Do you want me to use this? I think it'd be super fun, yes. Say it louder. He asked, could you use hemostatic gauze? You can use gauze and press on it and put a pressure wrap. You're probably more familiar with, I'm not familiar with a product called...
It's a combat blood stopper. So
yeah,
for big bleeds, you put it on there.
I guess if you have access to such a thing, but again, I would ask my veterinarian if that's appropriate. Let's talk about ointments, one of my favorite topics. The veterinary community, I don't know about the human side of it, but the veterinary community has gotten away from ointments because most of them do more harm than good. There's something that people love to do because horses get a wound and people love to monkey with it and treat it, and you're really leaving it alone is the best thing because the healing process is very complicated. There's different stages, and some ointments assist one stage, but they actually deter another stage. And God love it, Corona's been around forever. It's tradition, it's in every horse barn, but it may not be the best thing. So I'm gonna put this on this side. Probably if you just have, I'm sure there's some in here, good old triple antibiotic ointment. Everybody go out and make sure you have some of this. And the nice thing about these is they have, it comes in a little container. And so once you open it and use it, it gets pretty contaminated. Throw it away. Get a new one. Things don't have to be sterile, but they need to be clean. So if you use this, and I'm pretty good about the way I use stuff, like I don't swipe my dirty finger on this, I apply it, you know, or I'll apply it to something and use it. It's still gonna get contaminated, so pitch it. All right, but that will keep. Oh, a thermometer, very good. This is a digital thermometer. The thing you'll want to make sure is that it has batteries, and that over time, that the batteries still work. If you use what I prefer, the old-fashioned glass thermometer with mercury, they don't have batteries. But the mercury, like I have a bunch of them because I went one day to my kit to use it, and I pulled it out, and it said like 200 degrees, and I'm like, no problem. And I shook it down, and it said 200 degrees. Well, something had happened, and I probably put it on the dash of my truck because that's where everything goes to die, right? And so I pitched that one, but and I pitched it appropriately because it has mercury. So, but the reason I like glass thermometers is I can insert them, clip to the tail so it doesn't get pushed out into the stall. And then you go walk around and do other things. You've got heart rate to check, you've got respiratory rate to check, mucous membranes, gut sounds, digital pulses. My goodness, you need 2 to 3 minutes for that thing to cook in there. And then bing, it's done, take it out, stick a fork in, and you get your temperature. And the glass thermometers have been shown through research studies to be more accurate than the digital. Really, huh? Yeah, the digital thermometers tend to run a little bit low. But that said, they're like weight tapes that are also not completely accurate except to measure trends. So if you always use a digital thermometer and your horse is always 100 degrees and then you use it and he's 102, that's accurate and significant for your purposes. You have to know your baseline. So I'm not saying don't use them, they're good, but all right, so here's some heavier duty scissors. Heavier dutier?
Heavier duty.
Okay, this is not going back well. So these are nice industrial strength scissors. Oh, this looks like a flashlight that I broke. Again, flashlights should always be in a first aid kit. Make sure they have batteries.
Headlamps, better.
Oh, headlamps. Yeah. That's an awesome idea. Yeah. So the other thing I was going to say, let me borrow your pen so I can cross it off my list. Is when you get your kit and you're sitting down and you're playing with it and you're like, ooh, look at this, ooh, look at this. If there's something in here like the flashlight that you go, I'm not a big flashlight user, I'd rather have a headlamp or head loop, then replace it, put it in there. Customize your own bag. You know, like that's a pretty wonky hoof pick. I would never use that. It doesn't fit in my hand. It doesn't fit in my hand. So I'd probably take out all these. There's 3 of them in here because if you lose them.
It's going to break the first one.
Oh, I'd probably take these out and put in some real hoof picks. Yeah. What's, sorry?
I said, why is there 3? And she said, because you use it once and it breaks.
Yeah, exactly. Yeah. Don't care for those. Oh, she got tired. Okay. No. But you can see. So there's some liniment in there. This is just not going back well, so I'm going to just sit it wherever and put it back when I can. There's some iodine. Be careful when you use this. You don't use iodine straight. Okay? Bad things happen when you do that. Especially don't use tincture of iodine straight. Really bad things happen when you do that. This must be diluted. And they tell you dilute it to make it look like weak tea. And you can use water or saline. Weak tea, you gave me a look like you'd never heard of weak tea. Weak tea? Yeah. This is hydrogen peroxide. I'm not a fan of this. I was trained not to use this, that it doesn't it does more harm than good. And I think I stood up at some point and said not to do more harm than good. So I'm going to put this back here too. I'm not a fan. One thing it does is it tends to drive bacteria farther into the tissues. That's not what we want. As it bubbles and carries on, that bubbling and foaming makes you feel like you're really doing something, but you're doing the wrong thing. So I'd probably get rid of that. Oh my goodness. This is, isopropyl alcohol. Pro tip, great to have, but you know how one of the things that makes us feel like we're really being, medical is when we give a shot, we wipe with alcohol. You'll notice a lot of veterinarians don't wipe with alcohol. That's because we know that in order for alcohol to do its job, it is not the wet wipe that does the sterilization. I love that you nod when I say things. That's so awesome. It's the drying. So if you're going to use an alcohol wipe, that's fine. There's probably little cotton balls in here. But you have to wait till it dries. Now you have cleaned and disinfected the surface. The wetting is not the important part. And in fact, if you wet and then go right in, you have solubilized the dirt on the surface and you're taking it in. And the little bacteria are like, yay! Because they needed that little kick to get in, and you just helped them. So I'm gonna leave it in here, but we're gonna use some caution. So this is wound coat. It is blue lotion. It says right here. There's a time and a place for everything. I'm gonna go to Farm and Fleet when I go home because the stage of my horse's wound is at the Wonder Dust stage. And I'm gonna get some of that. So you're gonna need, like here. You all know what this is. Can you read?
Can't read
Is it?
here.
Yes, you
A
can.
swat.
Yeah. You should know it by the color and the shape. Yeah. And let's see what color it is. Oh, it's not open, but I can see through it. It's hot pink. It's like your coat. Yeah. Yep, your coat. This, and why do we like SWAT? Because it keeps the bugs away. So there is a need for this. And the way I use SWAT is I don't put it in the wound. I put it around yeah, she's got it right around the wound. So we'll keep that. Okay, so that's all that. How we doing so far? Okay. Oh, this is my favorite one. We talked about this earlier. What is this?
That's the stuff I have.
Somebody said it. Elastikon? Yeah. So this is what is that? Is that 2 inches? Inch and a half? Okay. But it's sticky. Elastikon, yeah. And so I was telling you I put the, what's it called? Non-adherent pad on the wound, and then I did the brown roll gauze at a really fancy figure 8, yeah. And then I take this, and I don't pull, because you never want to pull on the leg. I pull it out, and then I lay it around. And then I take my scissors, and I cut it. Yeah, this is good stuff. Whoever invented this, I hope they've made millions and millions of dollars. And then we'll get out some pretty color. Oh, it's a big one. Yeah, and it probably has a name. It's cohesive flexible bandage, because Vetrap would be a brand, right? Yeah. So it comes in amazing colors. I didn't know this. It comes in a 6-inch size. What? That's crazy. I did not know that. What's that? I've seen the little ones. I got a product to try. It is cohesive flexible bandage, but it is impregnated with a chew stop. So the first week I had the bandage, apparently the wound was very itchy, and he was chewing, like picking his foot up and chewing on it. I'm like, what are you, a dog? So I wrapped it all like I wanted to wrap it, and then I took my chew stop and I put it on the top of it. And he was like, ooh, suddenly I have other better things to chew on than my leg, so great. All right, this is, a survival rescue blanket. Wow, so that's like that reflective, it reflects your own heat back? Huh.
That's for people, right?
Well, I will tell you, when a horse has a trauma, And I don't mean a little wound like my horse has. I mean a trauma. The loss of body heat can be significant. Yeah, and I tell people, go to the barn, get a blanket and lay it on it, like if they're down, you know. But this might, I don't know how big this is. I don't have my reading glasses, but this could be big enough to lay on the horse and retain some heat. Yeah, because you don't want them to go into shock. Because once that happens, it's difficult to get back from that. Oh, here's the iodine scrub that I was telling you about. So you just, I'm not going to do it, but you just peel this off, and you have this scrub brush, like on Grey's Anatomy, that you can, yeah, one side is a sponge, and one side is a little fingers that, yeah. So this thing is awesome. I hope there's more than one. Oh, there, yeah, there's 1, 2, 3, 4. Yeah, 4. Note to self, when you use something, like you use one of these, replace it. And don't tell your friends where your kid is, because they will use things and not replace it. Yeah, and then you go to use it, and there's no hoof picks. And you're like, there used to be 3 stupid red plastic hoof picks in here. Who used all my hoof picks? Yeah. Triangular bandages, I'm assuming that's a human thing?
Yeah, that's probably the most.
Are those the slingy things? Yeah.
Or, yeah, it could be a pressure bandage. You can make a very easy pressure bandage.
Oh, like a neck tourniquet?
Yeah, exactly. You got to make sure you have stick on it to tighten it really good.
Sunscreen.
The company and you're the vet, is that how this
I'm a vet that represents SmartPak. She is a volunteer that is just crossing off things. That list. Can you hold that list up? Yeah, that's a list I made. It's an article on our SmartPak website that has a list of things that I think should be in your first aid kit. She's just making sure that they're all in here. If there's stuff on there when I get done that is not on that list, then we're gonna read it off. Yeah, because I may not agree with everything. Yes, that is an article on our website. Can you flip it back to the first page and show them what it's called? It's called, here, let me see it, I'll read it, because I have a microphone. Equine 911, here, let me see it. Equine 911, when to call the vet and when to treat it yourself.
Okay.
It's an excellent article. Okay. Sunscreen, more human stuff. There's bug repellent in here. Cleansing towelettes. So this one is a little bit of a mixture of human and animal stuff. And then there's 2 empty pockets on the back. Okay, so we've been through everything. What's on my list? You may have to come back up so I can read on the microphone. Oh, look at you have a sign. Okay. Phone numbers, contact info.
Do you want my glasses?
No, I'm going to hold it really far away and then I can read it. Saline. You know, you can dilute in water to clean most things, but saline is friendlier to the exposed tissues. It's pH balance is the right osmolality. Look that up. That's good. Cling wrap. Oh, that's the vet wrap. Tape. There was only one little tape in here, and I'm telling you, for horses, I'm not impressed. So even if you buy this big one, you're going to have to go and get yourself some bigger tape. Get the 1-inch white tape. Get some duct tape. Tape. You always need tape. Don't ask me why you need tape. You know why you need tape.
I have
Everything.
separate boxes for legs. I have a first aid kit, but like the Epsom salt,
Yeah.
the duct tape, I
Yeah.
have certain things for feet. I have a separate container for feet and legs.
What's not in here, probably because of state regulations, it differs from every state, but syringes and needles. What are some sizes of syringes that you all like to have? 12,
23.
28, they don't make,
Bigger ones.
like they make a 30 and a 35, yeah. So I like a 60 for giving stuff by mouth. I like 3s for a lot of the sedatives. You only need to give a ml or 2. 6s are good. I don't like them all. There's not a syringe size I don't like. What about needle sizes? What do you like?
20.
She likes 20. Do I hear it 18? 18. Say it again.
Depends what you're doing with it.
It does, because some things like penicillin oy, oy, oy. It's thick, it's, you know, you got to shake well before you use. And if you use a 20, you'll be there till Christmas, right? So you want to use a bigger gauge. You know that the higher the number, the smaller the diameter of the needle, right? Okay. But again, don't have any syringes and needles if you don't know what they're for.
Do you have a preference on length?
Yes, I do. She asked, do we have a preference on length? I like 1.5 inches. Horses are really big animals, and if you're giving, especially like penicillin, you want to make sure you are deep in the muscle. They're not a species you can give a subcutaneous injection to, like a dog or a cat, that you know you can pick up and inject just in that loose tissue. You cannot do that to horses unless you don't like that skin, because it will slough off. You have to get deep in the muscle. And like with the veins, I like 1.5 inches because I want to get deep in the vein. I don't want to risk being around the vein. That's really bad. So let me see what else is on the list. I have towels. To me, for a horse kit, there was not enough padding in this. The only padding they had was this. They had this trauma dressing, and then they had this. That is not nearly enough padding for horses. So you need to have, like this lady, a separate box with a lot more cotton, some pillow wraps, diapers, maxi pads.
Yeah.
Yep. And when something is bleeding, you just start piling on this stuff and wrap it, and you don't take it off to look, and you don't take it off because it's top. If it's bleeding through, like my horse's wound did, you just put more stuff on. Yeah, so you need a lot more, like 10 times more than this. Because the point is of this, you don't want to be looking for stuff when there's an emergency. I like to have a stethoscope in mind, and just get a cheap one. If you know, you can hear it. It just augments what you can hear. I'm really bad at palpating an artery for pulse or heart rate. I can't tell you how bad I am at that. So I like a stethoscope for the heart rate and for the gut sounds. So toss one in there. Clippers, because clippers now come in these little tiny ones that are battery operated and don't need cords. It means you get to keep it charged or keep batteries in, but oh boy, that's handy to open up let you see things better, get the hair away, and yeah. By the way, don't put anything on a wound before the vet gets there. And don't feel like, oh, I don't want to bother the vet. I'm embarrassed to ask them for their opinion on this little wound. Sometimes the littlest wounds are the worst, most severe. I had a wound on my horse. I'd be a vet. I had another vet come out for a second opinion. I'm like, this is what I think is going on. Do you agree? This is how I'm going to treat it. Are we all on the same page? And every week I give them a picture of it. And what would you use now? How am I doing? Do I still need to wrap? So I'm not afraid to ask a vet for help. So you all shouldn't be either, because assessing the wound the very first when it happens is the most important part of getting the right treatment. Because if it's a puncture wound, if it is in the joint capsule, oh, those are icky. Poultice, I like having a poultice, the liniments in here. I've got ichthymol in my ointment, a brown paper for that poultice, cling wrap for a sweater poultice, electrolytes. I think electrolytes are in here. I just didn't do a good job of finding them. Fly repellent, heat and cold packs, a horse blanket, a pill crusher. Yeah, that's everything. So is there something, we have like a couple minutes left, is there something that's in your kit that is not in my kit? Garbage bag? Ooh, I like that, yeah.
I have the long gloves.
The long gloves. This one only had the short gloves. Long gloves are a good idea, yeah. Oh, okay, yeah, and lube, good.
I like to have a small bucket designated for this stuff.
A bucket, yeah. How do you keep it?
I have a collapsible one actually.
A collapsible bucket. Wow, that's awesome. Anybody else have anything they want to share? Yes.
Use a water bottle if you don't have a sharps container.
Okay.
You need to get rid of your sharps so they don't puncture.
Yeah, because it's a nice, thick, closable, yeah. And what did you have? Okay. Pen and paper, yeah, that's on my list somewhere. Pen and paper. Reading glasses, pen and paper, contact info, yeah. We talked early on that only have medication that you know how to use and your vet has given you, so that's up to you. For some people, it's Banamine, not Banamine. Some it's Banamine paste, and some it's Banamine injectable. So, yes.
Banamine injectable, my vet told me once, if it's clear, it's still good no matter how old it is.
Her vet said if it's clear that it's good no matter how old it is. I'm going to tell you because I'm being videotaped, and also because I believe it, that read the bottle, and when it's expired, throw it out. Okay. Throw it out appropriately. There are ways to dispose of medication. I would just call my vet and say, I've got an expired bottle of whatever. Can you take it from me? And they'll dispose of it properly. I saw another hand up here.
So make sure you have something with a stopwatch.
Oh, a stopwatch. Yeah, because you're going to be checking heart rate and respiratory rate and, yeah, gut sound. So, yeah, you need a stopwatch.
A little medic trick we use is just take a strip of duct tape, 2-inch tape, put it on your leg, so when you are taking vitals or anything, you just write it right there at the time.
Did everybody hear that? That's a really good idea. I saw a hand up over here. Last question, by the way.
I do keep multiple of the small disposable hoof picks for when you have like white line or a fungus in the foot.
Yeah, so we're saying these are icky, don't throw them away, but also put better ones in. Okay, we have to go. Thank you so much. You guys were great. I guess I will clean up this mess myself.